Today I will talk about migraine, how to diagnose and how to solve it. So migraine is diagnosed based on the clinical symptoms. So there are clinical criteria proposed by American Headache Association based on which we can diagnose migraine. In that, the number one is headache, and the headache lasts for about 4 hours and up to 72 hours. It can be one side of the head or the entire head. And then along with the headache quality is the throbbing type usually, but it can be squeezing or the pressing type also. And the second symptom is nausea or vomiting. So the person can have feeling of nausea without vomiting or actual vomiting also. And then the other two symptoms are photophobia and phonophobia. Photophobia refers to intolerance or insensitivity to bright lights or glares. And when the headache is there, they don't like seeing bright lights. They want to switch off the lights and take rest. And second is called as phonophobia, where any loud noise or sound it irritates them and the headaches get worse. So any person who has these kind of repeated headaches which last for more than 4 hours along with two of these four symptoms, that is nausea, vomiting, photo and phonophobia, we can make a diagnosis of migraine. In most cases there is no need to do any brain scans, but if there are some red flags, like if the person is having, let's say, the most severe headache of the lifetime, then definitely a scan may be required. Or if along with the headache there is drowsiness or worsening of sensorium, or there is weakness of the face or hand or leg, or any fits or convulsions, so any additional symptoms, definitely brain scan should be done to rule out other causes of headache. But if you are very sure of migraine typical symptoms as I described, then brain scanning may not be needed in most cases. Now if we look at management, we have non-drug treatments and then the drug treatments. So first I will discuss the non-drug treatments. In that, number one is adequate sleep. So for preventing migraine headaches, one has to sleep for say 7 to 8 hours at nights, and the sleep should be consistent and regular, and avoid long afternoon naps. So about say 30 minutes or less of afternoon naps are ideal, but not more than that. Second thing is timely meals. So we know that delay in meals or fasting can trigger headache episodes in migraine. So they should have normal meals, timely meals, and then avoid any kind of stress. If there is stress, try to reduce it. And regular exercise or moderate physical activity also prevents migraine headaches. And then the next part is the drug part. So if somebody continues to have more than 3 headache episodes in a month, they require medical treatment. So we have various medications to reduce the headache frequency. And if their headaches are severe, then there are specific pain relief medications also that can be used.